Will eyelid shape from lower lid surgery return to normal without more surgical intervention? I recently had a lower lid lift along with a MACS lift. I had quite a bit of swelling in both eyes, with a blister type growth appearing in the right eye. My surgeon is out of state, but he did arrange for me to see another plastic surgeon in Florida who recommended I do upward massage. The pictures are at 5 weeks post-op. Can I expect more improvement with upward massage, or will further surgical intervention be needed to correct this? If so, what would be most recommended?
Thank you for your question. You've undergone a MACS lift facelift, and you've had lower eyelid surgery, and you are in a situation where you're asking whether your eyelids will return to normal or to the prior level from where it was before your surgery. Well, with the photos you submitted, and I understand that you're seeing a plastic surgeon who is not the original plastic surgeon, but is someone who is assisting in your postoperative care, that you're being recommended to have massage, okay? Now that's certainly fine. Not knowing exactly when you had the procedure relative to the photo you submitted, I can share with you that in my practice as a specialist in eyelid surgery and facelifting surgery, I get to see a good number of people who come for revision work for their eyelids as well as facelifts. And the typical situation that I come across with someone having eyelids that are pulled in that direction is that within several months of the surgery, it becomes relatively clear that even with aggressive massaging or even steroid injections, that the eyelid will not generally return to its original position. And there's a couple of basic concepts that account for that. When you talk about having a MACS lift, the MACS lift is essentially one of those shorter scar facelifting procedures where a lot of aggressive lifting of the cheek area is performed. And you can actually see this, the doctors who developed this procedure have written a couple of books about it and articles, that when so much cheek skin is recruited, that a lot of times skin has to be removed because it bunches up around the eye. The issues that I've come across with people who have performed this procedure and those patients finding their way to me is that unfortunately the cheek ends up descending. And when it descends, it causes a pulling of the lower eyelid. When that happens, there's a relative shortage of tissue to support the lower eyelid. Now, having had lower eyelid surgery at the same time, there are other factors that can also contribute to the relative position. So as a conservative measure, I agree that massaging is the first step to help do something called basically softening scar tissue so that there is what's called tissue remodeling and that the eyelid comes up as much as possible. Again, since I don't know the time frame of your original surgery, I can't speak exactly to what I would anticipate, but I'll tell you, generally, the patients who come to me are not fully satisfied with how much higher their eyelid got to even with massage, and that they typically need some type of revision surgery, such as the canthoplasty or canthopexy, where the lower eyelid has to be reattached to the bone, or grafting procedures such as the placement of an Enduragen graft or a middle lamellar graft. There are a lot of different things that are necessary in order to restore the integrity and position of the eyelid. Very often they also need some skin grafting. So although these all sound very aggressive and are basically the last choice in making a decision about the situation of the lower eyelids, ultimately, I always tell my patients who come for these opinions is there are two key elements to understand. One is that eyelid position is critically important for eye function. That means that the eyelids being in a position where the tears are able to distribute properly, when the eyelids are going in a downward slant, the tears cannot be distributed as effectively as when they're in a better position. So that's a critical part. And the second part of this is that there is a basic rule that eyelids that look good function well. So anatomically, if the eyelid is in a good position, it'll look better and it will function well, as what its main purpose is to protect the eye and to ensure the health and integrity of the eye. So for now, certainly massaging is the right thing to do, but I would say be prepared and get some additional opinions if you need to about what to do about the position of your eyelid. Again, the other part that I have to also share is that some people actually like their eyes to be relatively rounded, or kind of this shape where it almost becomes a new normal in certain communities of people who have eyelid surgery. So as long as there's proper lubrication of the eyes and you are satisfied with the results, you don't have to be so aggressive. So again, it's about your personal perspective and making the decision as time goes on, as the healing process progresses. So I hope that was helpful. I wish you the best of luck, and thank you for your question.